Hi there, my name is Aki Smith, and my dad was diagnosed in 2013 with advanced stomach cancer. At that time, he was treated as both a stage 3 and a stage 4 patient. This meant he underwent curative surgery, but because they couldn't get clear margins, he then had chemotherapy, radiation, and biomarker treatment. Today, biomarker treatment is really only used for stage 4 patients. My dad's journey combined outdated treatments with experimental ones, and I'm grateful to say that he is clinically cured. Every month, we're making new advancements in stomach cancer research and treatment, and every month is Stomach Cancer Awareness Month for us. His story is just one of many.
My dad was 50 when he got diagnosed.
I was diagnosed in 2021.
And I was diagnosed with stage 4 gastric cancer.
So they immediately got him in the following week for an endoscopy, and that's when they saw the tumor.
I was always making sure and screening for stomach cancer since my father was diagnosed as stage 4.
It was like a bomb just went off, like everything just went numb.
I first started having what I didn't realize at the time were symptoms probably in about 2019.
I had some pain in my left side.
Doctor checked me out. He says, you are bleeding somewhere internally.
I wasn't able to fully finish my meals like I used to.
I suddenly had a lump in my neck.
When they did the pathology, they found 17 spots of cancer in my stomach. And so I didn't get diagnosed as a cancer survivor until 2 weeks after my surgery.
I was positive for CDH1. So I said, all right, let's get my stomach out. That's the next step.
He'd need to remove my stomach, my spleen, part of my pancreas, liver, and diaphragm, as that was the thing that would give me a chance.
I was actually given about 6 to 9 months to live.
When they originally found it, they figured he'd probably only have a year.
And why are the mortality rates so high for stomach cancer? Because we suck at diagnosing it.
I'm hoping that there's better earlier diagnosis.
I know my doc said, if it would have just been like 1 month later, like we would be talking about a whole different story.
My hope is that we can get to a place where, for women, we have annual mammograms, we have pap smears, we have colonoscopies. My hope is that we can get to a place where there's some sort of screening for this.
Don't worry about the statistics because they're old. Technology is advancing and changing.
With today's medicines, there's a lot of good stuff happening nowadays for cancer patients right now.
All the advances that we've made in the last 5 years is phenomenal.
I did have my genes tested, and I've got Lynch syndrome, so that explains why I've had 3 different cancers.
I actually did genetic testing first, just to see if I had any mutations that could lead to that.
You're developing more types of medications that are not so corrosive to the body as chemotherapy and radiation.
And no evidence of disease whatsoever. Nope, it is completely gone. I actually had an endoscopy 3 weeks ago, and they said my stomach is completely normal.
Currently still in remission. I think it's a little bit over 2 years.
I have to live for my family. I have to live for myself.
I'm a stage 3 stomach cancer survivor for going on 9 years.
My hope is that they continue to expand on this immunotherapy.
I'm still currently on immunotherapy, and I just completed my 72nd treatment last week.
They did screen my cancer tissue. Then they did put me on immunotherapy that was matched to the cancer profile.
I got immunotherapy based on a high mutation burden.
The immunotherapy is definitely something very new, but I got lucky and it seemed to have done the trick.
Yeah, I'm glad what they're doing, trying to fight this in Washington, D.C. I know they recently went back there and trying to fight this disease, and give hope to all those people.
Every chance I get, I talk about it. Stomach cancer, genetic testing, funding for stomach cancer research.
Be a vessel of hope and vessel of inspiration.
And I think that's all anybody can do in this is try to be there for everybody else that's trying to go through it.
If someone in your family has had stomach cancer, it's essential to understand the potential causes, either environmental or genetic. I urge you to explore this with your doctor today. For my family, it was an H. pylori infection that caused cancer in both my dad and his brothers. Screening and awareness could save lives.